Perfect. It is 8:03 p.m. in Kenya, my heart home. So we're going to get started. And first, welcome Youth with Disabilities, Inclusive AI, and Mental Health. And I want to take a minute and acknowledge to those of you in Kenya, in East Africa, not in the US, thank you for spending your evening with us. And for those of you in the United States, welcome to your Lunch and Learn. Thank you for coming. My name is Carla Birnberg, and I will be your moderator. I am the Chief Storyteller at Next Step Foundation. For these purposes, though, I'm also the Impact Lead for the Upili Program in the USA. So more even than being the moderator, this is my why. This is my program, and I am so excited to have the opportunity to share these panelists with you. As you saw when you signed up for today, we have one guiding overarching question, and it's not something we will solve or totally answer today. So as we go, drop your questions that come up to you as you're listening to the panelists in the chat. I will grab them as we go, and if there are hopefully too many even to grab them, it just is indicative of the fact that this is the first webinar of many. So today we are focusing on how inclusive AI tools can provide that really needed mental health support for youth with disabilities. And we are going to begin with a short keynote from our own Mariam and Ndegwa. And then we will go to the panelists, have them individually answer a question or two, and then have a couple overarching questions for the entire panel. Before I hand it off to Mariam, I wanted to take a minute and introduce our panelists. I have this all written out. I did not memorize it so that I didn't get anything incorrect. We are very, very grateful and glad to have Jonathan Kaufman here. He is a disability strategist, psychotherapist, speaker, and amazing columnist. He is a global thought leader on disability, innovation, and inclusive business strategy with extensive experience in US and global markets. And he brings a cross-sector lens to mental health, leadership, and disability inclusion. He's going to focus today on how mental health, technology, and disability inclusion can intersect to form this international perspective, and how some lessons that we've learned with US-based disability advocacy can inform these AI-driven tools that foster this meaningful cross-cultural exchange. Next, we are so glad to have Dr. David Okello, mental health tech innovator, and he's the founder of Mental Health Solutions. He's a pioneer in accessible mental health care through technology, and he combines personal lived experience with AI intervention to reach these historically underserved populations. Today, during the panel, he'll be exploring the promise and the pitfalls of AI and mental health and share some of his learnings from already scaling these interventions across multiple African countries. And before she gives us her keynote, Mariam Ndegwa, she's officially project lead for the Upili program. I like to refer to her as all things, everything, boots on the ground for Upili. She is the project manager and a relentless champion of this new chatbot concept she's going to share about. And she's going to offer some insights into how AI can be effectively used in this sort of a community mental health model. And she's going to open the webinar with a keynote detailing why with the chatbot, how it works, sharing some early outcomes, and basically framing the panel that will follow. So I will mute myself and hand it over to you, Mariam, and I will pick it up after.
Thank you, Carla. Welcome, everybody. Good evening to Kenyans, East Africa. I think it's lunchtime where Carla is. So yeah, hope you'll enjoy your lunch as you listen to us. Yes, I'm going to take you through what AI will be doing for mental health. I'll just take you through what I have. It might not go the way I plan it to go, but I hope it flows. Sometimes we get taken away by how we talk, and this is how I'm going to take it through. So yes, Carla has mentioned, I'll take you through AI, the chatbot that we're creating for Upili. Like it will be coordinating with Upili, the project itself. So Upili's Councils with Disability comes into special schools. Uh, they in turn have a sit down with a group of 15 students, have a counseling session. Then, yeah, that's how it goes every other Saturday in high schools in Kenya currently. So a new part in came in for Upili, where we saw there's a gap between when the schools are in sessions and when the students are back at home. So what we came up with is a chatbot called Tumaini. So Tumaini is a new part for mental health support African persons with disability, students or whoever it is, so long as you're a person with disability. So Tumaini is the future of mental health. It's not replacing the human care. It's more or less supporting the human care. In absence of a counselor, it comes in between. So I'll take you through now how that works. I'll give you a story. This is something I've experienced through the 1 year we have been doing Upili. So, given an example, a student comes in January, has gone through the 6 weeks of counseling. Then they go back home for maybe 1 year, 1 month, that is April or August, or the 2 months when the school are, that is like from October all the way to January. So there's a very big gap in between. So when this student leaves the campus or the school for April holiday, they're good. They have self-esteem. They have all this all together. So when they go back home, uh, yes, at the first week they're good. The second week, kind of they're trying. When they come back in the fourth week, that's when you see there's a change. They were strong enough when they were in the sessions, but right now they have a setback. So you'll find they're kind of they're not vocal enough. They're not courageous enough anymore. So what happens? There's a situation where they lapse due to lack of support. Now that's the human care that we call the counselors. So we came up with Tumaini as a gap for the challenge that we saw in that. So so what are the barriers or what are the outlines, the layers that we have seen? Even before I go that far, I can give you the numbers. So 80% of persons with, not even persons with disability, but mental health crises, 80% of the people that are in this category, the crisis itself, are the middle class and the lower class. That means that is a very high number of people that are going through mental health. Now add it on top, you have a disability on it, so it's even worse in that situation. So what are the layers of challenges that we saw? There is therapy barrier. That's where you bring the cost, to bring the lack of availability of counselors, because I know that if you call it in East Africa itself, one counselor attends to almost 1,000 in one in a population. So you can imagine how that much of one person is taking in. There's also stigma. People are not really accepted that mental health is something that needs to be really taken care of. So if in my community they have not really taken in uh, mental health as a problem, so there's a stigma. I won't go to any facility for help. So that's the first challenge that we saw. Then the other thing is limitation of school support. That is, when we went into one of the schools that we are in, we saw there's lack of that support. So you can imagine how many schools currently will need to have a counselor just to take the students through a session, even just one session. Given there are not many counselors per se, and even now counselors with disabilities, even a challenge to get. So that is another challenge. Then the crashing stigma. So keeping youth isolated in communities. This is something that we have seen over and over and over. It's not something that is going away or something will go away just immediately. So how to tackle it? It's already a challenge. It's given that if the community does not see your potential, then they will never see anything beyond that. So even if you have mental health issues, they will never see beyond whatever is happening to you. So those are the layers of the challenges that we have seen. So the turning point, the Upili now the Tumaini itself now. How can we market? How can we make mental health support accessible to everyday or even outside classrooms, not just within the sessions like the 6 weeks that we have them within the schools? So the question came in to be, how do you identify the gap in a continuous support? Then what was the insight that we saw? Not replacing the counselors. Like I said earlier, we are not replacing the physical or the human themselves. It's just something that will be a gap in between when you cannot access the human. Now you can have something that will help you during that short period, that 5 minutes, that 2 minutes that you need support. So this one will be the one that will be helping. So the other thing is the solution. What is the solution? Adding accessibility to support or adding accessible support. So Tumaini is that. Uh, the other thing is now let me now introduce now how Tumaini works. Tumaini itself, it's an AI-powered chatbot that is built for persons with disability in Africa. That's East Africa, if I'm thinking large. Currently, it's just we're trying it in Kenya and maybe somewhere, some years down the line in Africa itself. So it's a basic technology that will be accessible through phone. No need for the data or internet or Wi-Fi. It's just you can do texting or if you have internet, whichever works for you. So we're making it accessible to everybody. Wherever you are, you can access it. The other thing is it will be designed to give feedback based on behavior of someone. So it's how you feed it is what will give you. It will give you the feedback. Um, the other thing is how Tumaini will be the visual or the action of it. So we visualize the visual of the future. So if given an example myself, I go into Tumaini chatbox itself. So I go there, I say, I want to be a doctor in future. So it will lay out tasks or it will give you goals for each and every day that will help you reach your potential. The other thing is just to reflect on your goals. So it will do that as well. So that now you keep up with the whatever goals that you have or you had outlined prior. The other thing is to build resilience. So every other day you have something to look forward to. So you are not tracking back, you keep going. So it's also career guidance as well. So it will have it's either what do you call it? It will have places to reference things such like resources. So you'll have things that will keep you motivated to reach your potential at the end of it all. That's the action of Tumaini. So a bigger vision for Tumaini is we envision it to be African leading global recognition model where technology will complement the human care. Like I said, We are not replacing it. We are not replacing the counselors, but we're just adding something else that will be accessible for you anytime. So it's a 24/7 kind of accessibility that's going to be there. So we are bridging the gap. We're moving for bi-month session that we do for Upili to a more, if it's, I wake up in the 3 a.m. in the morning, I have an issue, I have anxiety, I have exam tomorrow. Here comes to Tumaini, sets my pace for the day. Also for empowering the vulnerable community. So if you're somewhere, what do you call it? I'm trying to come up with an example that will fit this. So it's more moving from group counseling to like an individualized. Like now, this is just you. So it's just you being who you are. So for everything that you need, that one is what it will be providing for you. It's also the other thing is from being excluded to inclusion. So we are bringing everybody into one basket. So creating deep and thoughtful inclusion throughout this process. So it's mostly for the vulnerable. So you don't have to feel like you need to walk to a service center to be provided with the counseling itself. So it's more or less, hey, are you scared to go there? If you're scared, then here's Tumaini. Will help you to whatever you're going through. It will be something so that when you're able to, when you have a less anxiety. Like for me, sometimes walking to I'll call it what a mall. Sometimes I have anxiety, so it's like less preparing you for that big step that you're going to carry on. Lastly, call for action. What am I saying about this? So it's more mental health is a right. It's not a luxury anymore. It's something that we need each and every single day because we have struggles that we go through every other day. So it's not luxury anymore. So we need it. We need people to come in and make this possible. Design with compassion. It means it's here for everybody. It's not just it to be there. It's for you to understand, or it's understanding you at the end of it all. The other thing is to keep hope alive. I know sometimes we give up and we don't have somebody to make us feel like tomorrow matters anymore. So in this situation, you have something that is encouraging you every other day. And remember, if it is a student, when they're at home, when they come back to the school sessions, they have something to look forward for. Yes, they will give an example. Oh, when I did this, it told me this. Then the counselor will come and affirm whatever they said. It's for you. It's giving you hope to live tomorrow. So it's the same thing as the counselor does. But now the counselor will be more, you'll feel the person. So it's just the same thing. So thank you, Carla. And I hand it over to you.
I did remember to unmute myself. To echo what you said, I love how you emphasized that with as innovative as the chatbot is, and I've seen it in action, it's pretty amazing. We're not working to replace anything. It's just serving to be that bridge. We will always need the human care, but it's that bridge to not enough counselors, and also when students leave, they're home in the village. So really focusing on that to pat ourselves on the back. Innovation, I'm going to turn to you, Jonathan Kaufman, with our first question about inclusive innovation. What does this mean to you specifically in practice, and where have you seen it done really well or maybe not so well in the US, from which we might learn some lessons that could inform our specific implementation, but global implementation of this innovation in general?
Yeah, when I think about the word inclusive, by definition, I always sort of come back to the idea of belonging, because ultimately all of us want to belong. and all of us want to matter. That's the critical piece of all of this. And yes, I do work in the US, and I do work all over the globe. But I think one of the things that I'm looking at always in this area of mental health and what companies are doing it well. And I'll sort of bring it to an advertising company, actually, VaynerMedia, and Claude Silver, who is the chief heart officer. She has created a beautiful culture along with Gary Vaynerchuk in terms of understanding what does it mean to be in a company and actually not only be there to do the work, but to thrive. And that's a fundamental difference of how we look at work. It isn't about just going to a job. It is about belonging to a community. It may not be a family, because in a family you can't get fired, you can't get demoted, but it is about joining a community. And what does that mean? And if you are going to work and you are going to spend a considerable amount of time of your life at a job, you have to consider, what does it mean in terms of both your mental health, and I also call it mental fitness, because it isn't just about one's sort of mental health from a sort of cognitive standpoint, but how do you get through the day? And what are the challenges that people have to face? I mean, I think that there are a variety of companies that have certainly embraced that. VaynerMedia certainly is one of them. But if you look at companies that have been around this, Microsoft has done a wonderful job in terms of embracing this idea of wellness, but also the idea of inclusive design in their products and services. I mean, specifically when we're sort of dealing with disability. And there are a lot of organizations that have sort of taken note and said, okay, we need to sort of double down on the idea of what inclusion means. And I go back to this idea of awareness, but also it's designed with and not for. And what I mean by that is it's about co-creation. If you're not co-creating and you're sort of thinking about what do people need, and that's why it's so important, whether you call them business resource groups, BRGs, or employee resource groups, those are foundational in creating culture. And part of my training is as an anthropologist. And so it isn't just about the sort of clinical work I've done. I've said, okay, well, how does that resonate within a culture? And I studied organizations, and particularly businesses, and the culture of businesses globally. And one of the things we were sort of looking at in this sort of new world, I mean, where automation is happening, technology is happening, we're sort of in this digital transformation of where are human beings placed in all of this? Where are we in this new, I think, ecosystem? And people are afraid, people are fearful, people are anxious. But I think, as it's been said, I think numerous times at this point, Mariam said it, it's not about replacement. It's about how you augment. And I have seen it also in my own practice. As a psychotherapist, I work with AI all the time because they see me 45 minutes a week, and it's once a week. But then what do we do in the in-between? And particularly when people are in those dark places, in those moments, and heightened anxiety, heightened, whatever it may be, wherever they may be in their sort of own sense of mental health or wellness, it's how do I deal with it in the now? I can't wait. So what do we do, and how do we structure? That, to me, is something that's really beautiful. And we can create this sort of 360 inclusive environment along with the therapeutic work. But how do you engage, whether you're doing it at a laptop or whether you're doing it on something like this or whatever it may be? We're at a moment in time where this sort of idea of inclusive participation is in this moment of transformation. It's exciting.
It is. And since I'm the moderator, I am reserving the right to totally revamp my approach because I loved what you said. I love what Mariam said. And so, David, we are going to move it over to you. I'm going to skip around rather than do an interview style. So, here's my question for you. And you've kind of led the charge, so to speak, in initiating AI with these alternative therapies. So as we've thought about, Mariam's talking about the bridge for the youth when they go home, when the Upili counselors are on campus, and Jonathan points out that, I'm with my patients, clients 1 hour a week, and what about all the other hours? What safeguards, when we're framing it with AI, what safeguards or considerations do need to be in place when we think about ethical AI as far as mental health interventions? And I'd love for you to speak to that a little bit.
Thank you. Thank you for the introduction. I'm Dr. David Okello. And speaking on the question, humankind and empathy should be one thing. And out of that, we should be able to breed ethics. And out of ethics, we should be able to breed morals. So now when empathy is out of a human, it becomes very hard to create ethical solutions. I remember the first time I was exposed to AI, and it felt like having a sip of your favorite wine, kind of like when the vampire gets the first blood, and it was good. And I had a founder who was a tech specialist, and he brought a solution. Now, when I was working on this solution, trying to review how it was all working, it seemed so perfect. But then there was this problem that it didn't seem to get quite right. It always said yes to everything, kind of like always approved. And there was a time it was able to approve a suicide for a case as I was trying it. And I told the founder, hey, if the doctor here, Dr. AI is approving that suicide is on the prescription, then we definitely have a problem. Because if this one goes out there and the ministry meets you, then it is going to be a different story. And I tried talking him into understanding why I refused to get his tool registered without correcting that. And learning from that, I've been able to see the disparity that comes between mental health and community. And one of the issues is cultural relevance. And a mental health tool created, say, in Europe is trained with European models, will respond very well in Europe. But bring the same to Africa, you will fail to get that response. I think of it like AI is a student, and AI relies on machine learning. So we are teaching our AI medical student, and this AI medical student is being taught based on data. Now this data is the curriculum. So if our AI, Dr. AI is taught how to manage snow injuries and is taught how to manage snow flu, then is brought to Africa and is expected to treat malaria and malnutrition. If it's a system that was created to just say yes, yes, it will say yes, yes to everything that it does understand, it does not understand. So the final user, whether the final user is being helped or not, if as a founder, all you care about is monetary gain, then all you'll do is sell it, whether people are hurt or not. But with ethics, we should be able to get feedback from your users, and they should be able to tell you that, no, this one, here there's an issue. If this one is not corrected, then here we have an issue. Then besides data, culture and data privacy is also another issue, because as we do all this, we must remember that the data that is being collected online, it's not just to get what you call green gold. Today, I had somebody say data is green gold. So it's not all about mining information, but we want to also preserve privacy. Here in Africa, mental health is approached as communal, despite the stigma that it comes with. But I've looked at the West, it's more individualized rather than communal. Yeah. And so now with matters ethics, when assistance help is communal, how to ensure that patient privacy is still maintained in spite of that? Because you must respect culture, and medicine must respect culture. And but as we respect culture, you must also respect patient data and privacy. And as we do all these innovations and wanting to bring all these solutions, we must remember to do no harm. So if the AI technology is not trained on something that is local, we must ensure that we do something about it before we go to the people. And as you're doing this, it reminds me of the Rise and Rest program we just launched yesterday, where we want to use music and AI to bridge the gap in access to mental health care, so that we're able to have persons, adolescents, able to rise up in the morning feeling energized, and they're able to rest in the evening, get full night's sleep based on neuroscience. And as we do this, the main aim is co-design, so that as we are able to produce the right music, the right tools for them, they're also part of the process, so that they're also able to embrace the entire process. Thank you so much.
Okay, Mariam. So we've talked about the use of AI, a little bit about the ethics, and some cautionary details, Dr. Okello, which were super helpful. Here's my question to you, and you are now speaking apparently for the youth of East Africa. Do you think that because this generation, they're younger, they're more digital natives, are they more easily interested, vulnerable, interacting with a chatbot? And is there anything that, when we ran the focus groups, were there any stories that stood out? But most specifically, do you think these digital natives are more quick to adapt to chatbots because they've grown up using both AI quickly and just the internet in general?
Now, thank you, Carla. I'm not going to speak for the younger generation because I'm not there yet, but I'll speak from a perspective of persons with disability. During the focus group, we had that someone said the chatbot is good because I'll not be able to be moving around so much just to get services. So for them, it's convenient, it's easy, it's private. So it means a lot will not go out to people. People will not be, so what are they here for? So what are they suffering from? Because I remember when we first did our pilot for Upili, we had that problem of, so if we get that room, everybody will be knowing they are going for counseling, right? So it means they have a problem. So The Tumaini chatbot it's playing a part of convenience, privacy, and also they like to be on the phone most of the time. So they like researching things, they like asking questions. Given now we have ChatGPT, we have Gemini, we have the rest. So yeah, they're likely to like it or converse with it. Given that, I'll give an example. I don't like going outside more because I imagine where I stay and where the facility, if I was going to a hospital, it's a distance somewhere. So imagining I already have something here that I can work with easily, unless now I need the human touch of it. Because I felt, yes, the chatbot has done its part, but now I need something else. I need the human part of it. So I'll first act on what I have, then I'll move on. It's the same as if I have a headache, you start questioning Google. So I have a headache on this side. So what's the issue? So you start from there, then you'll go to see a doctor. So it's more or less the same kind of what I saw from our focus group. They like it because it's convenient. I'll ask questions that normally I wouldn't ask a human. But given that the chatbot is, we are still protective of what they are going to ask. Like Dr. Okello has said, you cannot go there ask about suicide, and it will tell you it's good to have suicidal thoughts, and you can go ahead and do that. So we still have that aspect of protecting also the user who is using it. So I feel it's good, but still we need to also look at it, given that we're in Africa. So there are things that we cannot say or we cannot go and ask a human. But if I have these, I'll get answers. Not the answers that I want, maybe, but at least I have something to work with. So for persons with disability, it's convenient, it's good. Yeah, and given that rural areas, you cannot get these services easily. So it's a win-win at the end of it all. So thank you, Carla.
I'm going to ask you a quick follow-up and then back to, I will give Jonathan Kaufman a heads up that he's next. You've been working more closely. I mean, I've had a lot of interaction with our Upili counselors, and they are now aware that, yes, we're going to integrate this to serve as that bridge of support. What kind of feedback have you gotten from the counselors around the introduction of the chatbot as a support system for them when they can't be there?
So for them, I've gotten very nice feedback because nobody wants to do something. Okay, we do the counseling for those 6 weeks. Then the child or the student goes back home. Then when they come back, we're right back where we started. So like I said, there once one went home, they were very vocal. They would talk, they would give stories. Then they went home, they came back, they were shut down to a point they were not talking. So no counselor would want such situations. So they're pretty much happy that they have something to keep them busy in terms of support when they're not there physically. Because I know there's that one-on-one kind of, it helps. But then again, when they go home, they're not really alone because they have something that they can refer to in terms of, if I have anxiety, what can I do? So if it gives you the first two points, then you'll go back to the sessions that you had back at school. Did our counselor teach us this? Did this? Then you'll keep now remembering what they were taught. So it will give you more, what do you call it? It will give you confidence to go on because now you have something that is reminding you every other day. Yeah, we talked about this. She said this is how we are supposed to carry ourselves. If it goes out of hand, this is how you do. If it is too much, we breathe in and out for a couple of minutes. Then you're back to good now to point one where we can reason out with ourselves and have a good pathway. So from the counselors, for them it's a win. At least now they know no child will go back to school and start from zero. At least now, I would rather start. They would rather start from a 3 rather than a 0. So that is a good thing from them. The last time that we had a conversation about Tumaini. Thank you.
Okay, Jonathan, wearing your hat of psychotherapist, coach, here's my question for you. You've shared that you're open to the idea of AI and implementing it in the work that you do. 10 years from now, which is probably 5 at the rate things are iterating, what do you hope mental health support will look like? And what do you imagine that AI's role will be, a decade from now in the current work that you do?
I love to imagine the future. And so when I think about this, and I talk about this a lot, I write about this a lot, I want AI to be an integral part of the sort of therapeutic process or even the coaching process. What AI can't do yet is when you're working with a client, whether individually or communally, people don't understand, AI specifically doesn't understand pause. It doesn't understand when a person's sort of breath starts or the sort of sweatiness of the palms. There are nuances that I don't know whether technology will get there. And even if it does, I look at this and say, this is my partner. I look at AI as a partner. I don't sort of lean in with fear. I lean in with curiosity. And that's the way I live my life, period. I lean in with a level of curiosity that's really important. So when I think about the future, I think about what are the possibilities that can happen as AI sort of comes, is sort of in this nascent stage and really gets to a point of being able to evolve. And where I see it going, the answer is I don't know. But what I do know is I'm engaged with it. I use it. I want to experiment with it. And it's been very helpful in terms of, we've talked about the bridge. And I think that's an apt term or word about how to think about this, because what it provides in those moments of heightened anxiety, heightened fear, heightened frustration, to say, I can go to this and I can go to this tool, and this may help me in that moment of, dare I say, crisis. And then then it's beginning the sort of follow up. So and it's always interesting when people are sort of alone and in their dark places. This is what can be useful. And that access. And there is this interesting question of the relationship between sort of technology and humans. And we've had the relationship between technologies and humans since our evolution. We can go back to the stick. Our relationship to technology has always been, this is just another iteration of it. It just so happens that we now can have a dialogue, as opposed to it be sort of a one-way relationship. So I don't think this is any different than the way humans have evolved and their relationship to technology. This is just jumping forward in sort of a light year perspective. And I'm excited for the future.
And I love your perspective, and it definitely mirrors what Mariam shared about our counselor perspective. Exactly what you say. It's not the substitute, but it's that companion for when you can't be there. I'm going to shift slightly, David, and turn to you with, I find the idea of the whole curb cut effect very interesting, that when things are initially created to help persons with disabilities, that literal cut in the curb for a wheelchair to go up, it ends up being used by mothers with strollers, by people with suitcases. So that's the curb cut effect. And if we're framing it like that, as you are focusing on, for this situation, youth with disabilities, how might these AI solutions created specifically for this group eventually avail themselves of the curb cut effect and be used much more widely, even though it wasn't intended that way initially.
Thank you. Yes. So now the curb cut effect. When computers were first brought out, we had the desktop with the keyboard and the mouse, and not everybody could use it. Then they brought in the voice assistant, and suddenly everybody now wants to use a Siri, and everybody has that on their phones. And it will be the same also with the mental health. And the good part with this one, though, is that by the time that happens, the conversation around mental health will be normalized as compared to today, where it is still so stigmatized and everybody is afraid to discuss it, and nobody wants to be associated with it. But even with the tools like Rise and Rest that we are building for neurodivergent children, one thing I'm sure of is that in the near future, even the neurotypical children will discover that this intervention is able to also improve their cognitive and emotional regulation capabilities. And they will also definitely want to enhance these and improve their focus. So yes, in the future, all these will come to harmonize. But the good part is that when it does happen, the conversation around mental health care will finally be normalized. The stigma will be broken. Thank you.
I'm going to come back to you, Mariam, with that 10 years down the road question so you can think about it for a minute. But I'm trying to do the reading the chat as we are going. We are just in the introductory phases. This is really our first announcement that the Tumaini chatbot is internally live and ready to go. We will be using it with our Upili counselors in this next cohort. And there are a couple of great questions around, has there been any testing, thank you, Edward Winter, of the chatbot with youth who are not included in the in-person counseling program? All of this is coming as we begin to share outside of the Next Step Foundation offices and much more widely the chatbot. So we are very much in the beginning looking at the question of how close are you to being able to expand this to other countries? We want to really create a solid, strong chatbot in the schools we already exist, which leads us to this. Sometimes AI gives dangerous responses. What about this concern? And this has been a very big focus from the start, making sure if we get, kind of alarming input from a student, it comes back with, and I don't have the number memorized, but the suicide hotline number for the location. We are very careful, and we're going to really make sure that all of the responses are supportive, helpful, and immediate before we use it in the schools in general or more widely for students who aren't part of our program. And great question. It's something that we've thought a lot about as well. And Mariam, for you, let's go 10 years down the road, because I know you well enough to push you to a decade. What do you hope mental health support will look like if you're fantasizing even about your program? And what role might AI play in this decade down the road moonshot fantasy?
10 years. 10 years is large, but then again, given its mental health, everyone at one point needs support. So it means out of 5, 3 will need support. So yeah, let me give an example of currently right now, we don't have Tumaini yet, but we have students who go through the 6 weeks. So what we have seen is from the sessions we have seen, those that are not within the program or within the cohorts also get impacted by whatever we are doing within the session. So it's something positive, just as small as that we have right now. given they are just 2 schools, and you're seeing greater things happen. So I'm imagining 10 years from now, Kenya has around, it's not an accurate number. This is just a number that I have from the list that I have. I have 38 special schools. So you can imagine if we do 5 schools each year, we might have half of them already being part of the program, being part of Upili and rolling out Tumaini. So apart from now, the Upili part of it, Tumaini will play a very big part because it will be reach whatever person, because we have a shortage of counselors with disability. That is already something that we are seeing we have challenge in. If we substitute it with Tumaini, this other hand, so one hand we have a counselor attending to 16, then we have Tumaini, which doesn't have a limit of how many can access it. So within maybe in 1 minute or in 5 minutes, we have around 100 people accessing that chatbot. It means we're reaching even a greater number. So it means we'll have, I don't know, I don't want to give numbers, but I know we'll have greater impact in 10 years, not just from the cohort within Upili, but also outside, given that if I'm positively getting support, it means I'll go and tell somebody else, you know what, this is what I learned from the counseling session. This is what I learned from the Tumaini chat box. So it's giving support. It's like peer-to-peer now, because now you can imagine we have the counselors, we have the peers, we have the chat box supporting, we have parent support, we have teacher support. You can imagine how big that village is already just by that view. So in 10 years, I think we'll be somewhere in Asia, if I'm not wrong. Hopefully, that is my greatest hope. Because Africa, yes, Africa is big, but then again, moonshot, Europe is the next place we want to touch as well. So hoping for big dreams to happen. So yeah, so 10 years, ask me about Europe.
There's your mic drop moment. We are about 5 minutes before the hour, and I know everybody not in the US is probably ready to shut it down. And Jonathan, thank you for spending your lunch with us. I cannot emphasize enough, as I said at the start, this is such an important conversation, and one that it feels like every time I wake up, AI has kind of iterated a little bit more, and it's changing so rapidly. So I have written down for myself what my 3 takeaways are, and I will now share them with you. Really, that focus on how AI, when done correctly, we've spent a lot of time making sure it's culturally sensitive, culturally contextual, can understand English and Swahili. When it's done well, it really breaks down barriers, whether they're geographic, whether they're economic, or whether they're social. And sustainable solutions need to be built with and alongside the communities we are creating them for. And scalable AI, really, from our perspective with youth with disabilities, it needs to grow and adapt alongside the community that we are declaring we serve. So thank you very much. This is the first of many. Thank you for your questions. I'm going to cut and paste and do both articles answering them, but that will be our next webinar topics as well. So thank you for coming. We appreciate it, and I hope it was helpful and interesting. Have a good night and afternoon.